Hello, future nurses. So welcome back to this video lecture series and to this YouTube channel. For this video lecture series or playlist, we are going to focus on health education. So um, please follow this playlist, follow this YouTube channel for you to have an extra resources on your subject health education as we try to present or discuss some of the salient topics of this course for this semester. So to start, um, health education was not yet a coin or a coined term before, especially during the prehistoric times. Even the word phrase patient education is not yet a term, a phrase used before, especially during the prehistoric times. When, if you still remember your topics, your discussion on fundamentals of nursing, you knew that the nursing profession is already a prehistoric profession, a prehistoric calling for some or vocation for some, and even health education is not a term before. So on references that we have read, they use the phrase patient education to pertain to this activity, to pertain to this basic responsibility of nurses. And patient education has been part of the healthcare since the first healer, whoever he or she is, um, the first healer that or who gave the first patient advice. So it's not even patient education, but the phrase used was patient advice. Okay, usually the advice will pertain to treating his or her ailments or illnesses or some manifestations that the patient or patients may experience. Again, patient education is not specifically used, but the efforts of the first healers, as the fundamentals of nursing would call it, efforts also is aside from healing them, there is the responsibility of informing the client or his patient, encouraging them, and also giving caution to patients to follow appropriate hygienic and therapeutic measures during the prehistoric times. And we know that those times it is not yet recorded as also scientific knowledge or scientific practices. These are usually based on beliefs, based on supernatural things that they believe that they have possessed. Okay, and education was already one of the earliest and the most common interventions during the prehistoric times. And moving forward, during the mid 1800s, through the turn of the 20th century, this is known to be the formative years with already an organized or somehow a formal healthcare. During the mid 1800s, this is considered to be the growth of patient education. Okay, it is the phase wherein there is development of organized healthcare and emergence of nursing and other health professions also rose. Okay, technological developments. So there is a sudden boom and emphasis of patient caregiver relationship was also enhanced, was also improved. If you remember in your fundamentals also, the character of Sadie Gump, which gave the bad image of nurses, but during Florence Nightingale's time, this notion, this impression given to nurses improve positively. Okay, And during this time also, the 1800s, this is the spread of tuberculosis and other communicable diseases. There is also growing interest in the welfare of the mothers and children. And speaking of Florence Nightingale, we know her as one of the um, pioneers of contemporary or modern nursing, considered to be the lady with the lump. Florence Nightingale is one of the advocates also of patient education, and she authored literatures like one book is entitled Health Teachings in Towns and Villages. So this literature focused on health teachings or patient education or health education in school and home teaching. Okay, so that is one of the contributions of Florence Nightingale in the concept of health education. Moving forward, during the first 4 decades of the 20th century, this is considered to be the second phase of organized healthcare, and the support for maternal and child health and also public health nursing improved, and this started in the United States. Public health nurses instruct mothers on how to keep their infants healthy, their children healthy. Uh, d- um, More advanced technological equipment also were invented, especially diagnostic tools, new vaccines, new antibiotics, effective treatment, and surgeries also were studied and implemented. Public health nurses teachings were considered a precursor to modern patient and health education. And this led to education programs in sanitation, in immunization, and prevention and treatment of infectious diseases. As you can see or notice, during the first 4 decades of 20th century, public health nursing is was really emphasized. Okay, and knowing that or due to their observance that most of the illnesses, the diseases came from a public setting. Okay, so also this led to the growth of public health system. During the post World War II, late 1940s to 1950s is considered to be the third phase of organized healthcare. Again, more significant scientific accomplishments and profound change in healthcare delivery system. Patient education was overshadowed during that time because during the war, technological advancements for these wars or nation disputes were the emphasis. Okay, so a first, although this was overshadowed, there was a significant milestone during this decade. The first references to literature in the early 1950s were published. Okay, so in 1953, Veterans Administration Hospital issued technical bulletin, patient education and hospital program. So this was in hospitals for the veterans in the United States. Okay, again, it's entitled Patient Education and Hospital Program. Okay, again, during that time, it was not yet coined health education, but patient education. In the 1960s to 1970s, um, uh, patient education was a specific task. Okay, so it was really emphasized that it is already a part of task or responsibility of the caregivers or the nurses during this decade. And general education on health was given to individual patients, especially on the hospitals. civil rights. If you remember world history, 1960s to 70s, especially in the Western countries like the U.S., civil rights movements rose. Also, women's movement in I think in Europe also started, and consumer and self-help movements were organized also. Hospitals became involved in various education programs. So from the public setting, um, there was a shift, or there was a spread to the clinical setting, and patients are considered to be healthcare consumers. And it was during this decade that healthcare is considered to be a fundamental right, as your books in Fundamentals of Nursing would describe health is. Okay? Teaching is based on individual patient needs. Okay, so this was a decade that you can also say that care is individualized. Okay, meaning it is based on the needs, on problems, concerns of the patients. Okay, and in 1971, uh, there was a need for patient education. And if you know President Nixon of US, he is one of the first persons, if not the first, who used the term health education. And during this time, health education was involved in the patient's Bill of Rights. In the 1980s to 1990s, disease prevention and health promotion was the emphasis, was the focus of health education. Instead of treatment, instead of rehabilitation, because the program really wanted to lessen the burden and economical, physical burden, mental burden, and economical burden of having a disease. So again, the focus was on disease prevention and health promotion. Okay, and this decade also was the establishment of educational and community-based programs. So again, there was a shift again from in clinical setting to the public or to the community setting. Okay, so since it was all about prevention, it was all about health promotion, it is just right to focus on this public or community setting. Nursing standards on health education was also formulated, and this will be presented on the next slides. Staff education was also a very important task or responsibility of the heads of the different nursing offices. This is to improve nursing care interventions. Okay, more trainings, more education programs were given to the staff nurses. And during this time also, interdisciplinary team approach was implemented, or were deemed to be having a very good approach, more effective approach. And also, aside from team approach, the healthcare team approach, the patients and the significant others uh, also participated in the treatment and rehabilitation regimen. And the competencies were also set together with the standards. So if you are a nurse, you're expected to be a health educator also. As I've been mentioning, it is one of the basic responsibilities of any healthcare provider, for that matter, whether you are a nurse, a doctor, dentist, even nutritionist, any member of the healthcare team. Okay, so competencies of a nurse as a health educator includes one, you should embrace personal ethics on social responsibility and service. Okay, so aside from knowing that it is your job in terms of or work for you to earn, there's an ethics of it. Okay, but speaking of ethics, you should know the goodness and badness of the things, the activities that you do, and Nursing is highlighted here as a service. Okay, it is a social responsibility. Okay, and I hope as young as you are in your health, in your nursing career, you are already embodying this one or inculcating it in your minds that nursing is caring, nursing is service, it's a responsibility. Okay, moving forward, as a health educator, you should be an accurate educator. Okay, so meaning if you're an accurate educator, you should be scientific. You should have at least research-based evidences. You should provide evidence-based practices, and you should also be clinically competent nurse. Okay, because this is also part of being a competent of competent caring. Okay, not only the skills that you have, the activities that you perform, but also health education. Then incorporate multiple determinants of health in clinical care. So when you say you incorporate determinants, it's not only focus on one aspect of or one factor of a patient or your client, but be holistic, okay, in your care. Um, Also, a health educator, a nurse, rigorously practice preventive health care. Okay, whether you are in the public setting or the clinical setting, do not forget to also provide preventive health care. And one of the interventions that you can do to promote preventive health care is through health education or client or patient education. Then, as a nurse, one of your competencies is also to facilitate the improvement in the access to health care for those with unmet health needs. So this one is, it depends on your institution, in your hospital, on how to usually assist or facilitate patients with um, problems in accessing healthcare. Okay. Then, of course, you should practice a relationship-centered care. And when you say relationship-centered care, it is a friendly professional relationship care between a nurse and the patient, okay, and their families also. Okay, it's genuine relationship. Okay, provide culturally sensitive care to diverse society. So, one of the challenges of being a nurse wherever you are, or make it an example in the Asian countries or here in the Philippines, we are a multicultural nation or multicultural nation. You should be aware of the different cultures of your patients. Okay, if you remember in your theoretical foundations of nursing, there is what we call cultural care also. It pertains to a situation or a concept that for you to care more effectively or efficiently, you should you should also consider the culture of your patient. The less you know the culture, the less you can give efficient care. Okay, use communication and information technology effectively and appropriately. Okay, so communication, we have the therapeutic communication and non-therapeutic communication. So this is basic concept and should be kept in mind and in heart. I know that you knew this one already in your fundamentals of nursing, and you will carry this until you become professional nurses. Um, because communication is a very important, vital, same uh, um, um, concept, activity, humane nature. And in terms of us being healthcare providers, nurses for that, we should always be therapeutic to our patients. Information technology refers to the use of technology in our profession to promote health education. Um, Especially this time of pandemic, uh, we are let's say lucky enough, or we have this advantage, okay, I mean advantage, of having technologies, because as nurses we can still provide or promote health education effectively and appropriately. Then as a nurse, we as we grow in our profession, learning is continuous, okay, and also as a nature, okay, of our profession, we continue to learn and we continue to help others. Okay, so those are the competencies of a nurse and as a health educator also. So these are some just a diagram, okay, on how to summarize the concept of health education. Okay, there will be planned learning experiences, and that can lead to improvement of health literacy and adoption of healthy behavior. So experiences are very important, especially if your clients are adults, because adults want learnings to be practical, and they want their experiences to be considered also. Okay, so you plan it well to give a very good health education session to them, or whether it's formal or informal. um, then what is important here is there is improvement in the knowledge of the patient or patients or your clients, and hopefully, okay, we persuade them, or we influence them in the adoption of healthy behavior, because that's one of the goals of health education, if the not the main goal is to persuade clients to adopt healthy behavior or healthy lifestyle. Then to continue, we have here a model by George Engel. Okay, the proponent in his model was called or is called BioPsychosocial Model. Okay, so we have three aspects of man here overlapping: biological aspect, psychological aspect, and social aspect of a person. So, according George Engel is a psychiatrist, and he introduced this model in 1977, and he advocated the need for a new medical model to explain health and disease. Okay, um, although this model, according to histories, this was already applied, okay, during the ancient times in Asia and in Greece, even as far as 2600 BC to 500 BC. This model was already applied. Okay, so psychosocial model is an approach that states that human experience of health or illness is greatly affected or determined by the interplay or interrelatedness of the following aspects, okay, or factors. So let's present them one by one. For biological factors, um, health and illness is affected by immunity level or the resistance of the person, uh, genetic factors, susceptibility or predisposition. Okay, so more on genes, more on resistance, more on immunity. Okay, when we consider biological factors. Psychological factors, on the other hand, pertains to the feelings, to the affect, to the person's ability to express her or his emotions. Okay, So if there's something wrong in his feelings, in his ability to express, this may lead to illness or disease. It's like in the physical aspect or the biological aspect. If the immunity is low or resistance is low, it can lead to illness. But we are not saying that automatically, okay? We're just saying that the person is at risk. Like, for example, if you have this hereditary disease in your family, you have the genes of this disease, you may have the disease. We're not saying that you are going to have it 100%, but there is a chance. Okay? Regardless of the percentage of the probability or the chance of having it. Okay, then also in psychological factors, the belief in one's worth, okay, your belief on your own worth as a person, or especially if you're affected by how people see you, how people look at your worth. Okay, so that can also predispose you in illness or health state. Okay. Long-term stress, so it's under psychological factor. Long-term stress affects the body systems, and anxiety affects health habits also. So this stress, if not controlled, may lead to illness or disease also. Um, so we are told to calm ourselves, our acceptance, relax. Okay, relaxation can actually change body responses to illness, to stress, to anxiety. Okay, then again, this psychological factor affect our perception, our thoughts, emotions, attitudes, and even behaviors. On the other hand, last one in this model, social factors. Social factors pertains to usually it pertains to your socioeconomic status, your culture, beliefs and practices, poverty, technology, and the environmental influences and conditions. So, in short, these factors can either lead you to health or illness. Okay, so that is the BPS model. Okay, so again, it shows a direct link between the mind and the body, and also an indirect link with the intervening social or environmental factors to explain disease causation or disease um, causes. Okay, again, just to summarize, when you say biological component, this seeks to explain the cause of illnesses or diseases as a result of a breakdown in the physical or physiological functioning of the body. Okay, just like what I've mentioned earlier, one aspect is immunity, one aspect is heredity, and we can say the other chemical processes that is happening inside our body. Psychosocial aspect deals with how the individual perceives health threats and the state of emotional control, temper, discipline, his or her motivation to stay healthy, and psychosocial factors also cause biological effects by predisposing the patient to risk factors and risk-taking behaviors. Okay. Um, One example that we usually give is a person who is depressed or in extreme sadness may become alcoholic. Okay, and this can lead to temporarily forget his or her problem, which may lead to chances of having liver cirrhosis if he become really alcoholic, uncontrolled alcoholic, severe alcoholic, and aside from liver cirrhosis or disease, can further lead to his or her death. Okay. So that is the BPS model. Okay, again, in this slide, the purpose of health education is to increase the competence and confidence of clients for self-engagement. Okay, so the goal, on the other hand, is to increase the responsibility and independence of clients for self-care. So we want that our client will be self-reliant, okay, in terms of health, and not to be over-dependent, okay, to healthcare providers, especially. We want that in the primary healthcare statement, we want the health to be on the hands of the people. Okay, meaning they know how to take care of themselves. We're not saying that they will not be consulting anymore, but on the other hand, they know how to ask consultation. They know when to ask consultation. They know to whom to ask consultation. So that is also putting responsibility on the individual. But what is better here, to look at it is more on the preventive practices, disease preventive practices, and health promotion practices. So that is the main aspects of care in health education. So what are the characteristics of effective health education? Okay, one is it is directed at people who are directly involved with health related situations and issues in home and the community, like the parents, people who have influence in the community, or the so-called opinion makers. Okay, so it is a direct care, okay, to those who are involved, not only the patient but those people who can really bring about change, especially in healthy situations or healthy lifestyle, healthy behaviors that the community, okay, can adapt. So on bullet number one, we are pertaining to a healthy community. We're not only talking about a family, we're not talking only of an individual. Okay. Second, the lessons are repeated and reinforced over time using different methods. Okay, so health education is a continuous process, and it's also the change that health education may bring is gradual. Okay, so as a healthcare educator or health educator, you must be patient in dealing with to clients, because as I've said, the change you are expecting to clients are not overnightly done. This is a gradual change. So you need to have repetition of your health education, of your topic, of your concern. And why is the word repeated emphasized there? Because in education we have this law of repetition, okay, wherein if you repeat maybe one practice or one concept several times, tendency is it will stay longer in your memory, or it aside from it stays longer in the memory, the more that you can practice it, the more that your client may practice it over time until he or she adapts it in her own or his system. Okay. In bullet number two, it was only mentioned that you use different methods, okay, to present your lessons, to present your topic, so that your health education session or your topic may become interesting. Okay, so you become, as a health educator, you become resourceful, you become creative in presenting your topics. Then third, the lessons are adaptable and use existing channels of communication. Okay, so this is also related to number two. We're talking about different ways of channeling communication or education or teaching. It may, aside from a formal discussion type, you can express it through songs, through storytelling, through drama, depending on your clients, depending on the number of clients, maybe. Just like how our Department of Health advertises or educates through television. They make jingles. Okay, they make it creative. Okay, and there, yeah, they use mass media also, okay, to educate more people. Okay, even at homes or in the community. Health education is entertaining and attracts the community's attention. Okay, then health education should also use clear, simple language with local expressions. So when you are to conduct health education, you should know your audience, the level of their knowledge, their culture, their in short, you should know their background. You should have an assessment of who or what your clients are, and you may use the same language, okay, the local language that they have to connect with these people more. Okay, if you're promoting the culture, it's not a problem for as long as it is safe. As long as on the other part of it is you should uh, still prioritize the scientific ones which we have learned in school, but we should also respect their culture. Okay, but if the practices are not safe, again, you emphasize the reason behind it's not safe, or what's the proper one, okay, the proper alternative or action to do. Emphasizes short-term benefits of action. Okay, so we're not immediately after the long-term effect, but we, as I've said, health education is gradual. So take the small steps, okay, in transforming, in persuading people to adopt healthy lifestyle. Okay, short-term benefits are as important as the long-term ones. Okay, and usually before you reach the long-term ones, you start with the short-term benefits first. Okay, provides opportunities for dialogue, discussion, and learner participation. So if you conduct health education, whether it's formal or informal, it should be a two-way communication. There should be a dialogue, okay, between you and your client, your patient, whether it's an individual, a family, or community. So there should be a dialogue, there should be a participation coming from your clients. Okay. Then as a health educator, you use also demonstration to show the benefits of adopting the practices. This is quite a challenge for us, especially we become the examples, okay, of these people, of these clients. Uh, as the old Dutch would say, walk your talk, okay, practice what you preach. So for them to somehow be influenced, okay, be motivated by being an example. Okay, so these are some of the characteristics of effective health education. During the modern times, okay, especially this era, um, there are issues also faced, okay, in health education. Okay, when you say contemporary period, okay, we talk about what is modern, what is current, what is up to date, the present day, what is existing. Okay, so the health educator is also faced with enormous or countless, or many huge responsibility in facing the challenges, as well as on the positive note is having opportunities, okay, due to increasing demand of the society. Um, there is a return to population-based health promotion and maintenance vis-a-vis hospital-based emphasis. And emphasis is on health of the community and the adaptation of healthy behaviors and lifestyle also through health empowerment, through people empowerment. The health educator is also considered as a community health worker. Okay, not only a health educator in the hospital. Okay, so when you are a community health worker, your main concern is to improve the health of the people by using different methods and strategies, just like what I've mentioned earlier. And there is a call for developing health strategies globally. Okay, as we can also observe during this time of the pandemic. And there is integration of health education and action. Okay, so health education and action one is now a clamor that cannot that can no longer be ignored by the community by in a global scale. Okay, just like what we see in the different advertisements, health education advertisements. Uh, During this time, we are asked to practice minimum health standards. It's like washing of hands, um, using face masks, face shields, use of alcohol, social distancing or physical distancing. Okay, so that's a clamor, an outcry that we in the healthcare field are trying to address the whole public. Okay, so issues also face in the health education this contemporary period. So some are globalization, war and terrorism, social instability, disease and poverty, environmental degradation, facilitating learning and teaching on critical health and the challenges in the 21st century. And yes, of course, this time we have this pandemic. So aside from the issues, the trends in healthcare. So there is a new healthcare economics. There is medical globalization. There is advances in medical technology. So when you say new healthcare economics, emphasis is on primary healthcare. Okay, not on the commercialized healthcare, but more on primary healthcare. This means that you can that the people can manage their care. Okay, um, what is good here is it lessens the severity of possible condition of the people who practices primary health care. And if ever that the person will be hospitalized or clinically confined, there is a possibility that that the person may have early discharge of clients from hospitals. Also, when we talk about healthcare economics, we talk about health insurance costs and other countries. I'm not sure if you're aware, in the Philippines, years ago, they tried to reduce the healthcare insurance costs and prevent also overtreatment or overstaying of patients in the hospital, which are considered to be unethical in an institution and unethical practice of some doctors. Okay, if you're aware of PhilHealth, there are packages, and usually these packages require number of hours to stay in the hospital. Okay, if the package for this disease is having high insurance costs, which the insurance institution will pay the hospital, considering the number of hours that the patient will stay. For example, it's already considered if the patient stays at least 24 hours for a certain disease. Even though the patient can be treated at home, what the doctor or institution will do is they will order that the patient be confined, okay, to have that insurance payment, okay, and that is considered to be unethical. Again, reduce healthcare insurance costs and prevention of overtreatment or overstaying of patients, and these are unethical, okay, practices. Then we also have established centers of excellence to provide services effectively and at a moderate cost. So those institutions which practices excellent service and ethical service, quality service, are recognized and also given good accreditation and recognition that is made to the public. Okay, so these institutions should follow. Okay, letter C is decentralization under new healthcare economics. Okay, decentralization is also called your medical prosumerism. Okay, this is an emergent issue because prosumerism, as research would say, is a movement away from purchasing completed goods and services in favor of purchasing portions of them. Okay, and it is similar to do-it-yourself movement. Okay, in health improvement. What is not good here is you do not consult to a professional or licensed practitioner. Okay, you have significant patient opportunities to gain knowledge through the internet and medical databases. So patients now frequently make their own choices because of what they read in the internet. Doctors in the social media would say it's good, it's just okay to watch YouTube videos, search on the internet, but it's still best, okay, to consult your physicians, your healthcare providers. And if you're really fond of reading internet contents, be sure that these are accurate ones and up-to-date ones. Okay, so people nowadays make their own decisions or choices as to what they feel or as to how to diagnose themselves, treat themselves, the medical products that they see and possibly they use, and they become the practitioners of themselves. Okay. Another form of prosumerism is alternative medicines. Okay, although this has scientific, this is the good side actually. This has scientific proof. This has research, and it's still considered to be a good practice. So when you say alternative medicine, consumers use a wide variety of folk practices to promote health and potentially cure diseases. Examples of alternative medicines are acupuncture, acupressure, even aromatherapy, even yoga and massage therapy. Okay. Here also we promote herbal plants, the use of herbal medicines. Okay, that's also an alternative medicine. Then number two, medical globalization. Okay, medical globalization is made popular by the term medical tourism. Okay, medical tourism, where centers of excellence or hospitals and centers with world-class facilities and amenities can attract Okay, people from all over the world, and they become tourist attractions. Okay, for example, one country is known for this health advancement, and some people from other parts of the world, they want to have it, to avail it. Okay, they go to it, and I think Philippines is one of the countries which really is going for it, knowing that it's like cheaper than the other countries. Um, Other people from other countries obtain services, and cost of treatments and medications at a very reasonable and affordable price is their what they are venturing at for these consumers to go to them. Then advances in medical technology. Okay, the most current development in managed care, okay, or self-care management is disease management. Okay, this seek to improve patient compliance with optimal health behavior by promoting attainment, uh, keeping self-administration of treatments, and proper general health behavior in terms of lifestyle issues. As one research would say, the the uh, longevity of life of the people in these modern times may be prolonged, okay, because of this advancement in studies on health, technologies for health. Okay, the life expectancy may be lengthened, okay, because of this self-care management advancements. So the future directions for patient care are: one, new setting and environmental linkages, new technologies, greater emphasis. As I say this, you can search on your own what are the new technologies, what are the new career, what are the health advancements, which in which you may think that it needs the responsibility of a health educator. Okay. Increased third-party reimbursement as cost-benefit ratios demonstrate the cost-effectiveness of consumer education, as shown by shorter hospital stay. So this bullet pertains to what I've said earlier. The cost is lowered. Medical cost is lowered for the majority of the people can avail it. Okay. So we're in the next part of our video lecture. We are going to discuss four um, famous, okay, or four more commonly known theories in health education, and this will be presented in the next video lecture. And I hope you understood something, learned something, and I hope to see you also virtually in the next video lecture series about theories in health education. Thank you.